I saw this as an opportunity to get more than just a research project done, but to really invest in myself professionally and personally. My project involves a mobile app that we call FamilyRoom.health. The app is really intended for family members to get a lot of information, context, emotional support, guidance through the ICU experience. This program has allowed me to interact with peers all across the country that I wouldn't necessarily get. The exposure to mentorship has been incredible. Just being able to access doors that were opened for me because of the fellowship. It's just really been an enlightening, iterative growth experience. I'm a better scientist, but I would argue that I'm also just a better professional and leader and human after going through this experience.
I am proud to be a Betty Irene Moore Fellow. I had the greatest opportunity to grow as a leader, as an innovator, and as a policy advocate through this experience. Native Hawaiians, specifically children, have a higher rate of asthma. With this tool, we were able to provide health information that was specific to our communities, and it looked like our communities. A lot of my world was in Native Hawaiian health, and coming into this fellowship, I was able to bring that with me, but also expand my knowledge around what is nursing science, and really embrace the profession that I am a part of. And in return, I've been able to accelerate my career in ways that I never thought possible.
The Betty Irene Moore Fellowship really helped me do some unique and really community engaged approaches that I think may be difficult to get funding from traditional sources. One of the benefits of having such a large cohort is that you really get to see and learn from other people's leadership journeys. Just talking about the challenges and how they've addressed situations, the pieces you can learn from that and kind of integrate into your own practice. It's almost trial and error without you having to try it. I'm sad to not see everybody monthly, but I'm excited to see how we can translate a lot of what we've done in the pieces and the leadership components, and how, at least for me, how I can take that into my next steps and my next project.
My project worked with a local historical museum to deliver a community-based group acupuncture intervention for individuals who live with chronic pain. The project really challenged me to overcome some of the obstacles moving outside of the traditional implementation of research in our academic medical centers to really partnering with community-based organizations who particularly don't always engage with research. The fellowship really improved my confidence to pursue roles which I probably would have thought that I wasn't ready for, and kind of gave me a support network to be able to pursue those roles outside of my institution.
My project for this fellowship has been working with older adults, so people who are over the age of 50, as they transition from chronic homelessness into permanent supportive housing. The idea of flexible funding was really attractive because the older adults who are exiting homelessness are not always, prioritized in other funding streams. It's helped me to be able to build trust with the community in that, I'm in the community working, I've got students, partners, we're all doing this work, but then to be able to immediately say, oh yeah, let's do that now. The way that people kind of think about their research and the work that they are doing, it has expanded my thinking about what is possible.
Maternal mortality in the US compared to other developed countries is high. My project focuses on early screening strategies to identify women at risk for hypertensive disorders of pregnancy. It's a global problem. The fellowship has allowed me to focus on this project globally in the US and in Ghana. I hope that giving birth to one life should not take another life. And these screening strategies should be able to identify women so they can receive the necessary intervention to save lives of both mothers and babies.
we were able to test the very first intervention that was youth engaged and youth informed in terms of improving sexual health education here in our very rural state of New Mexico. Too often what can happen is we get told what we can't do. The leadership within the fellowship is asking us, no, think bigger. And so being able to do that with like-minded, innovative thinkers is a very unique experience. I have the most amazing cohort of fellows with whom I've traveled this journey the last 3 years. And so being able to share this experience with the fellows in my 2023 cohort, I will forever be grateful to the Betty Irene Moore Fellowship.
This funding gave me something NIH grants rarely offer, like protected, mission-driven resources with room to be responsive to what this population actually needs. We can introduce new technology to older adults who need to deal with everyday challenges of managing their chronic health and memory issues, and teach them how to use this new technology and also making meaningful connections. The fellowship kind of has fundamentally changed how I see myself as a scientist and a leader. I'm not just conducting research, I'm architecting how nursing engages with technology and engages with patients. I really like the idea that the community doesn't go away when the fellowship ends, and it's a resource I'll have for the rest of my career.
We used a mixed methods approach to examine how nurses' sleep loss and scheduling practices can contribute to medication administration errors. It allowed me to show how research can drive concrete changes in scheduling, staffing, patient safety. I'm so excited about just the potential to help improve the nurse work environment and to support nurses and to finally have their voice at a national level when it comes to fatigue-related, safety events. Many of us learned that Betty herself experienced a medication error, and so that experience is one of the reasons why the fellowship exists. And I hope she's looking down and smiling, and not just at my project, but at the incredible work of all the fellows and thinking that is exactly why I did this.
So I got interested in the fellowship, I think, for two primary reasons. One, the opportunity to learn how to grow as a leader within nursing, have the seat at the table, have a stronger voice for nursing, and also the chance to be part of this amazing cohort of nurse scientists from across the country. So this program has really been transformative for me, not only from the people that I've met, who are incredibly inspiring, but also to give me the confidence to identify opportunities that I didn't even maybe know existed, and then the confidence to open those doors and walk through them.
At the time I was considering this fellowship, I was a little lost in my leadership journey. I was thinking about what's next and very much going along with a prescribed path of what I thought I should be doing next. Being a part of this fellowship, the impact that I've had is that I really intentionally think about my leadership journey. I challenge systems more. I'm more comfortable taking risks, and I think less about roles and more about the impact that my leadership is going to have. You just have to go for it. When there's an opportunity, when there's not an opportunity, just keep pushing the boundary, just keep writing your grants and your papers and putting the science out there, and one day everything will click and fall into place. And really, I've been so fortunate that the fellowship has allowed me to see that.
Dr. Nelson Brantley is an expert in rural health delivery.
I remember showing up to the very first convocation evening event, and I almost cried because I thought, I know why they picked me now. I'm among people that I had longed to be with, and here they were, people like me that wanted to do important work and research that's very different in terms of really focusing on health equity, health disparities, and being innovative with the research. So to be able to be in a cohort like that thinks like me and has the same kind of values and goals in life was just wonderful. I really do feel like now I have not only 15 close friends within my own cohort, really have, I think, 64 people that I know I can call on anytime across the nation, and we can problem solve together.
One of the biggest lessons that I've learned is to speak up, and then next to delegate. I think this journey has allowed me to open my mind and to say that, to look within myself and reflect and say, you are a leader. I think for me, what will be different is that I will step outside of the box and look for opportunities to lead. And that's within my institution. But also, I feel like this program has helped me to look at my individual skill set and my passions and to see how I can step outside of my own box. I'm excited about the future in general. I feel like so many doors are already opening and will continue to open. And I'm just happy I'm no longer afraid to step through those doors.
Well, my vision is to have a positive impact on the health and healthcare of Native American people through research, advocacy, and policy, and by training the next generation of Native American researchers. The fellowship really has accelerated my leadership by giving me time, mentorship, and a safe space to pilot ideas and scale them with community partners. To be given this opportunity, I think, to not only grow as an Indigenous researcher, but grow or adapt an initiative, I think that is critically important for our resource poor settings. So my hope is that we do see decreases in youth suicide in communities when more communities become engaged in finding solutions to issues of concern through research.
What the fellowship has helped me accomplish in developing as a leader and my leadership goals, part of it was the time and space and reflection to figure out what those goals were. Right as we were getting ready to launch, our clinical site lost their funding. I had to pivot. I remember my mentor telling me very clearly, well, that's part of being a scientist. You try things, and sometimes they just don't work. Who you are as a person is just as important as your professional values and goals and the work that you produce.
Before this fellowship, I was someone who I enjoyed a challenge, right? Because when I'm not in my comfort zone is when that's when the magic happens. This fellowship has grown that exponentially, right? And a willingness to try sooner, faster, fail more, not have it stick, just learn from it and keep innovating, keep iterating. It's a massive gift when I'm 80 and I look back at my career. I think that my experience in the Moore Fellowship will have been one of those pivotal moments when I realized that I started to come into my own. The relationships that I've developed, the networks that I'm continuing to build, like the fruit, the work that I'm doing now, the fruit of that is probably going to be years from now. So that's exciting, right? The adventure just continues.